Assalamu alaikum and good evening all of you. Before starting anything, I would like to share a famous spiritual quote which I always use to amplify my abilities. It goes like Imam Ali Raza quote from his father Imam Musa Qasim. He quote from his father Imam Jafar Sadiq. He quote from his father Imam Muhammad Baqir. He quote from his father Imam Zainul Abidin. He quote from his father Imam Hussain. He quote from his father Maula Ali. He quote from the Holy Prophet Muhammad sallallahu alaihi wasallam. And he said, what faith is? Faith is knowing from your heart, expressing it through your tongue, and performing it with your organs. So whatever you do in life, faith is the basic necessity for everything. So moving forward toward the cell cycle, so the cancer cell follows the similar cell cycle of the normal cells, that is the M phase, G1 phase, S phase and the G2 phase. So starting with the cell cycle, that is how a normal cell cycle works. The first activity phase of the cell cycle is known as the M phase, in which the mitosis starts, that is the cellular replication starts. After completing the cellular division, the first gap or the resting phase, which is known as G1 or gap 1 phase, is observed, in which there is a gap or a break or a resting phase in which the necessary enzymes for the DNA synthesis are produced. After the gap in which the necessary enzymes for the production or the synthesis of DNA were produced, the cell follows the second activity phase, which is the S phase or the synthesis phase, in which the DNA synthesis is observed. After the DNA synthesis, the cell enters into the second gap or the second resting phase, which is known as G2 phase, in which RNA and other necessary proteins are synthesized. So this is a normal cellular cycle. The cancer cells also follow this cell cycle and are to be stopped through the chemotherapy, in which the cell cycle specific drugs produce their action and stop the cancerous cellular cycle on the specific stages, that is mitosis and synthesis phase. Now during the development or the progression of the cellular cycle, certain moieties are involved in regulating the cell cycle, which are the proto-oncogenes, that is the normal genes which contain the information for the production of specific proteins, and some tumor suppressor cells which control or balance the cellular growth level, that is allow them to replicate in a normal manner, in a normal number, instead of the rapid cellular growth as observed in the cancerous growth. Furthermore, some proteins which are known as cyclins, along with the cyclin dependent kinases, which are also known as CDK, are involved in the maintenance and the regulation of the cell cycle by maintaining or keeping them at a normal rate according to the need of the body. Finally, the retinoblastoma proteins are the proteins which are involved in the regulation of the cell cycle, but unfortunately, as a result of the modification or alterations at the cellular level, which we have discussed earlier, including the genetic factors and the non-genetic factors, which are also known as environmental factors, as a result of those changes and the production of mutagens and carcinogens, these regulatory bodies are also altered as a result of that alteration, and these regulatory bodies are no longer effective in regulating the cell cycle, and thus the cell cycle is progressed according to the need of the cancerous growth, that is at to the other parts and other tissues and other organs of the body. So this was how the cellular growth manipulates the normal cell cycle due to the non-sensitivity of the regulatory bodies as a result of alterations at the DNA level. So moving forward towards the staging of cancer, the staging of cancer are of uttermost importance when we are considering the treatment of the cancer. The cancer treatment is often possible at the stages of 1 and 2, while the treatment at the stages of 3 and 4 are often complicated. Stage 1 is considered when the cancer starts to spread from its original site. That is, at stage 1 the cancer or the cancerous growth has completely affected a specified location, and now it is ready to spread from that specific location. That is, it has successfully affected a specific location of the body and now is ready to spread from that specific location towards the other parts of the body. The stage 2 is referred when the cancerous growth has spreaded from the origin towards the neighboring tissues, and the neighboring tissues are successfully invaded by the cancerous growth. This stage is referred as the stage 2. Moving forward towards the third stage, in this stage the cancerous growth has been successful in invading towards the nearest lymph nodes of the surrounding tissue. The cancer now has successfully spreaded towards the nearest lymph nodes, and since when it has entered the lymph nodes and entered in the circulatory system, whenever the cancer enters into the circulatory system, it is very prone to cause the systemic cancer or cancer at multiple origins, which we also call the metastasis. Fourth stage, after invading the lymph nodes or entering the circulatory system of the body, the cancer spreads to different tissues and organs of the body. This stage is known as metastasis, and this is the last stage, and more or less any organ or any tissue can now become cancerous. The signs and symptoms of the cancer: at the brain level, the headache, seizure, and vertigo is observed. At the respiratory level, cough, hemoptysis, and dyspnea is observed. At the lymph nodes level, the lymphadenopathy is observed. At the liver level, the hepatomegaly and jaundice is observed, and at the skeletal level, the pain, fractures, and spinal cord compression is observed. Now, these signs and symptoms are very common with the other diseases of the body, so the cancer is very difficult to identify or diagnose before stage 1 or stage 2, and the signs and symptoms are often confused with the other diseases. So the diagnosis of cancer is of uttermost importance, but is not commonly diagnosed before the stage 1 and stage 2. So this was all about the introduction of cancer. Now we will discuss the pharmacology of antineoplastic drugs, and further the management protocols or the pharmacotherapy of some specific cancers.